Alzheimer's disease, more commonly referred to as simply Alzheimer's, is a chronic neurodegenerative disease. As the word neurodegenerative suggests, Alzheimer's slowly becomes worse over time. It's degenerative, due to progressive brain cell death. Alzheimer's is most commonly associated with memory loss. However, as the condition advances, symptoms grow to include language problems, disorientation, and mood swings. The eventual loss of bodily functions ultimately leads to death 3 to 9 years after diagnosis. Largely, the causes of Alzheimer's is unknown, and the reason for the associated brain cell failure is unknown. There are, however, multiple theories and hypotheses about what may cause the disease. Some of these hypotheses include genetics. Genetic heritability has been ranged from 49% to 79%. Research has shown that people with a family history of the disease are more likely to develop Alzheimer's. The risk has been known to increase, especially if there are more than one members of that person's family who have had Alzheimer's. Tau abnormalities. This hypothesis says that abnormalities in the tau protein, which stabilizes microtubules, can cause the disease. It is theorized that certain types of tau protein tangle with others inside the nerve cell bodies, causing microtubules to be destroyed, ultimately collapsing the neuron's transportation system. It is hypothesized that this causes problems in the communication between neurons and eventually leads to brain cell failure. The effects of Alzheimer's affect multiple other body systems. These systems include the digestive system and the neuromuscular system. Alzheimer's affects the digestive system in lots of ways. People with Alzheimer's can have trouble swallowing food, which can lead to liquids going into the airways, which can cause ammonia. Bowel control is also affected by Alzheimer's. People with more advanced forms of Alzheimer's have trouble using their muscles properly, and most people in the late stages of
erectile dysfunction
of the disease can no longer walk. This is because as the muscular system weakens, the muscles become rigid and hard to move. Alzheimer's also can reduce the response of our circulatory system, which leads to drops in blood pressure. Depression is also known to come along with Alzheimer's. Motion. Not much is known about Alzheimer's or what causes it, but it is speculated that it comes from the advanced changes that our brain makes over the years. Essentially, the disease continually kills brain cells until the brain can barely function, leading to death. Alzheimer's almost always happens to older people. According to alz.org, the diagnosis of Alzheimer's must require very careful evaluation. The first step is to check medical history. One of the signs includes mood changes. Some other ways to check are by checking medical history, physical and neurological exams, as well as blood tests and brain imaging. At the moment, there are no cures for Alzheimer's. Some drugs, however, can help with behavioral and cognitive symptoms. Currently, researchers and doctors are searching for ways to help improve the lives of people with Alzheimer's. Medical marijuana, 420 blaze it, has a chemical in it called THC. I'm sure you boys know about it. And it can actually slow the production of beta amyloid proteins, which is thought to be one of the main contributors to the progression of Alzheimer's.